काफी कंसर्निंग टॉपिक है और बीइंग अ एशियन पेरेंट्स तो लाइक आपको भी अंदाजा होगा कि बहुत से हमारी कम्युनिटी के लोग हैं जो कि काफी रिलेक्टेंट हैं 5 से 11 साल बच्चों की वैक्सीनेशन में।
The Omicron is favouring the upper respiratory tract. Significantly, there's been a big rise in the hospitalizations for children under the age of 5. And that's probably because, although thankfully children still get a mild illness, relatively mild illness with COVID compared to adults, with Omicron affecting the upper respiratory tract a little bit more, because children have smaller upper respiratory tracts, that is leading to a little bit of, more trouble and difficulty for them in breathing. Now, in terms of the vaccination, again, we are lucky because already, I think in America alone, over 8 million children in this age group have already been vaccinated. And what we've seen is the vaccine is very safe. For the 5 to 11-year-old group, they are getting a 10 microgram dose, which is different to the 30 microgram dose for the Pfizer vaccine that is given to adults and children over the age of 12. That vaccine is given 3 weeks apart, but in New Zealand, for your 5 to 11-year-olds, the vaccine spacing is between 8 weeks, just to try and decrease the chances of side effects. Now, in terms of side effects, the most common ones are, ones that last only about 48 hours, similar to what adults felt, a little bit of pain, maybe some fever, maybe some tiredness. In terms of the scary things, that there's been a lot of misinformation online, and that's talking about things that you would have heard of, myocarditis and pericarditis. Now, what is myocarditis and pericarditis? These are terminologies, medical terminologies for inflammation of the lining of the heart or the muscle of the heart. Now, this has come as incredibly rare. In 8.6 million children that were vaccinated in the 5 to 11-year-old group, there were only 12 cases in total. And that was a little bit more in boys than in girls. But again, you're talking between 2 and 4 per million. And all of those 12 cases were discharged. They self-resolved. There is a condition called multi-system inflammatory disorder, which can happen 4 to 6 weeks after infection in children. And this has an incidence of about 1 in 3,000 or 1 in 3 or 4,000 children. It's had a 90% rate of success in avoiding this multi-system inflammatory disorder. And so all the people who went to ICU with this multi-system inflammatory disorder in the US were unvaccinated children who ended up, needing ICU care. The other thing is long COVID, where you have persistent symptoms that can last up to 6 months or perhaps more, can also occur in children. In adults, it's at about an incidence of 1 in 3 people who've had an infection. In children, it's much lower, much less common. We still don't know the long-term effects of COVID infection. So we are seeing increases in things like diabetes, both type 1 and type 2.
So diabetes in kids?
In children, yes, because we know that COVID can affect virtually every organ in the body. So recently there was just a big study which has shown that there's a huge increase in cardiac risk for adults. So that, we just don't know, that we are exposing the children.
What other complications
whereas the vaccination gives a really good protection. It is much preferable that you allow your immune system to learn how to fight this virus first by inducing immunity via vaccination. In medicine and in primary care, we say prevention is better than cure. And the gold standard for prevention for any infectious disease is vaccination. And this vaccination is very safe. It's been given to millions of people around the world safely. Yes, there have been some side effects, but in the little kids age group, it has been found the risks are low. And also, the problem with Omicron is when so many people are going to be infected, when you have such large numbers, then it could be your child. That could be one of those unlucky ones that get that side effect. So it's far preferable. Doctors would never, recommend anything because we look at everything in terms of a risk versus benefit profile. The benefits of having the vaccination far outweigh very, very minor risks compared to getting that infection.
Yeah, and we are good too. Like I was seeing numbers today for kids vaccinations, like 45% kids are vaccinated now between
Yeah.
that age group, which is really good that we are still going slow, but not really bad. So yeah, so
Another
kids are
point with kids vaccination, because only at the moment it's between 5 to 11-year-olds. For those under 5-year-olds, it's very important also for pregnant and breastfeeding mothers. If they are due, I mean, if you haven't been vaccinated, please get vaccinated as soon as possible. And if it's
yes.
been more than 3 months since your second dose, please get your booster, because via your breast milk or when you're pregnant, some of these antibodies will protect your baby. And
Hmm.
unfortunately, the vaccine for the 6 months to 5-year-olds, 4-year-old group is probably still a few months away.
The question that I received from our local pharmacies that they have said that many parents coming and saying their kids have phobia of needles.
I think a lot of the time parents are quite worried that the child will find it scary to get the
Hmm.
vaccination.
Yeah, that's
And
right. Yeah.
I think it's really important that don't underestimate your children. Most of the children in that age group, for the most part of their life, all they've known is COVID. And children are very smart. They are very motivated to protect themselves. They've seen their parents and elder siblings get the vaccine, so involve them in it. Don't focus on the fact that it is a vaccine or it's a sui or it's a needle. Talk to
Hmm.
them like it's a medicine. It's a device. It will, help protect you and help make you be able to stay at school,
Yeah, have a
which is
discussion
very,
with your child. Yeah.
yeah. And in terms of, things like pain, children feed off their parents as long as the parent is calm. You take simple distraction things like whether it's their favorite toy, a show on their iPad. On the actual site, if they have a real needle phobia, you can get some local anesthetic creams from the pharmacy, which you can apply. And apart from that, also things like just applying a little bit of ice for a minute or so before the or an ice pack will help numb the area. And just make sure
Hmm.
that you distract them and you remain calm. And I think it can be a very positive experience for them.
So
Yeah.
if a child is having eczema, so will that child be suitable for vaccination?
Absolutely. I mean, eczema is common. It's important with any chronic medical condition affecting, adults or children, that for our general health and immunity, it's important
Hmm.
that we maintain good control. Obviously, they're not going to be putting the vaccination in a site where there is clearly broken or inflamed skin. Um,
Hmm. So
but
they
if you
also
have
see
any
like.
concerns, speak to your GP and make sure
Mhm.
that you're using your proper treatment, and it's absolutely safe.